Okay, video is starting. I ain't falling for that again. Are you actually gonna go to? Yeah, you're live. Cool. I end up doing this thing twice. Uh, so today's two different medicines. One is Bixa Orellana, which is a South American plant related to another Chalamogra plant. And the other one's Blatta Americana, which is American cockroach, which hasn't, both of these haven't really been proven much. And then we have Blatta orientalis, which is Indian cockroach, which comes tomorrow. And but I wanted to get into, I'm also going to do some acute remedies and how to do an acute case. Someone who has an acute situation. Acute is sudden onset, and it basically goes away. It resolves itself. Like the flu comes on quickly, and 7 to 10 days, it usually goes away. If you use homeopathic medicine, it goes away quicker. That's why course of antibiotics, they usually say take, it's like a 7-day course, because they know at the end of the antibiotics, whether they'll give it, antibiotics are for bacterial infections. If it is even a virus, they give the antibiotics, which really does nothing, but they know in 7 to 10 days it will resolve itself. That's nothing against them. They don't have um, a lot of things that'll help with a viral infection. Anyways, Bixa Orellana is a South American plant, as I said, recommended for leprosy, eczema, and elephantiasis. Of course, we know what leprosy is. It's a skin, these are all skin things, and under the skin and elephantiasis. I always said elephantitis, but this is elephantiasis, which is basically an infection under the skin. Leprosy is also an infection of the skin, and of course, eczema is. So, hasn't really been proven, but that has been utilized by herbalists, and in South America. And that's why, my mentor Robin Murphy always said, you as a homeopath, you will become a herbalist also, because we stand on the backs of the herbalists, on the alchemists who have utilized a lot of these things. Uh, and, from that, we know a lot of times what these herbs are good for. And when we do find out what they're good for, then we use it just like Hahnemann did with cicona bark. They were using that herb to cure, yeah, I would imagine they were curing malaria. So they're wondering, why does this work? What is the principles and properties? Now they didn't have a lot of the tools we have today to see what the chemicals are in that. And even when you have those chemical or those tools, are they really figuring out what it's good for? So when the herbalists, know what it's good for, a lot of times we'll, like Hahnemann did with the cicona bark, he took that herb until he got symptoms, and the symptoms were malaria symptoms. So he realized what'll what a substance will do to you. That substance in a healthy person, that substance will do the same thing, or heal, I guess you'd say, a sick person that has those same symptoms. So that started the whole process. That's why they're doing cockroaches, they're doing metals, they're doing all kinds of different substances and having people take it until they get a proving. They get, the symptoms. And that's what he did. He got the symptoms of malaria from taking cicona bark, realizing that that's why it's healing, because it'll cause in a healthy person those symptoms of malaria. He got the fever and all that stuff, and diarrhea and everything. If you see someone who has, no matter what the sickness is, a flu, a cold, a COVID, or whatever it is, you see those same symptoms that they've written down in a materia medica. You see them same symptoms in a sick person, it will take care of that disease. So Blatta Americana, which is the American cockroach. Yes, they did make a medicine out of the cockroach. Blatta Americana has been used as a remedy for dropsy, which is like edema or fluid retention. And I don't know, another place it says nausea, I don't know, and has a popular reputation in jaundice. Jaundice is, liver problem that causes your skin to turn yellow. Blatta Americana was proved by Muir and developed symptoms of jaundice, yellow sclerotics, which is the skin stuff, ascites, which is fluid retention, various forms of dropsy, again, fluid retention, yellow complexion, extreme weariness, general prostration, and weariness on going upstairs. So they can't, exertion doesn't work for them. Pain shifting from back to shoulder blade, acute pain in chest with want of breath. So that's, like um, almost I don't want to say asthma, but anyways, they can't get their breath. Blatta orientalis, which I'm going to do tomorrow, has that same symptomology. Heat in urethra, so a burning or a heat in the urethra when urinating, showing a relation to cantharis. Cantharis has the same thing. Where is cantharis? So that's why I say we got all these medicines here that all the symptoms have been, cantharis has really been proven. So let's see the urinary kidneys. Acute cystitis, nephritis, constant desire to urinate, intolerable tenesmus. Urine is burning, scalding with cutting pains and intolerable urging. Fearful tenesmus. So that's, oops, on my, I have a lot of things in my book that just fell out because as I look up medicines and I look at stuff and I research things, I basically get it. So it's the same, cantharis would be, if you looked up a medicine or a symptom like burning in the urethra, you'd have cantharis, Blatta americana, and probably Blatta orientalis. So it's good for asthma, dropsy, and jaundice. Let's see. So Bixa Orellana. Yeah, Orellana. Leprosy, eczema, elephantitis, as I said. Blatta americana, jaundice, yellow sclerotics, which is inflammation of the mesenteric glands, which is in the intestines. Ascites, which is edema in the abdominal cavity, which is fluid retention, and dropsy, asthma, and jaundice. So that's what these medicines would be good for. They're not proven as much as they should be. So you basically, if we could get the money, and that's what it would take is money to pay people to come in, take these homeopathically take these medicines. And as I showed yesterday, when you take the medicine, there's, you'll get symptoms. They'll get sick, basically. Even though it's a sugar tablet that has no actual substance in it because it's been diluted out so far, but it's the energy of that, and your body recognizes that energy, rises up to fight it, and gives you the symptoms. When that happens, there's other medicines, homeopathically, that can antidote it. So once you get sick, take the symptoms, you antidote it. So now I want to get into this. This is very, and I'll probably do this the next couple of days, different remedy, what do you want to say? Oh, Lord. Different ways to prescribe or to treat a case, to look at a case, to do a case. And, in the beginning of the Materia Medica, which is this book, he has acute remedies, alchemic remedies, Bach flower remedies, which I went over a couple of them recently, aloe vera, biochemical remedies, causative remedies, bile nosodes, which there's a lot to all these, cell salts, chronic remedies, all these different things. So today I wanted to start with acute remedies, which has these are the type of homeopathic remedies prescribed for acute infections and fevers. Example: aconite, arsenicum, album, Baptisia, belladonna, bryonia, chamomile, gelsemium, ferrum-phos, pulsatilla, pyrogen. Acute remedies are prescribed in the following manner I'm going to get into, but these remedies here, like gelsemium is sleepy and dopey. Belladonna is hallucinating and flushed face, pupils are dilated. Bryonia is uh, worse by movement. Chamomile is they're very aggravated, and whether it's an ear infection, a flu, whatever it is, these medicines will work for baptisia. Trying to think of the keynotes, and that's what you're looking for is basically the keynotes. Arsenicum album is a lot of burning and restlessness. Aconite is comes on real quick and sudden, and a lot of restlessness also. So these are the keynotes that you look for, and that's why you're able to, like my wife's headache, whether it was a headache from a flu or a gastric headache or whatever her headache was coming from, stress. When she said burning, I thought right away of arsenicum because that's a lot of burning with that one. Now, there's a few other ones that have that. If she was delirious, I would have thought of belladonna, or throbbing. That's what belladonna headache is. But this is the way you look at it. Belladonna in a flu or something, they'd be delirious. Gelsemium, they'd be real dopey and tired. That's why the lady, no matter what it was, in California, she had her daughter had COVID, and I said, "What's going on?" And all I got from her was, "She's not moving, and she's just laying there." I said, "Go down to the health food store, get gelsemium." She went down, she got gelsemium. Then she said the fever broke, and I have that in my community. Her test. I said, "You owe me." She said, "What? You want me to?" Because she was helping me to, get this business running, get this out there. She said, "You want me to help you with your business?" I said, "No, no, no." I said, "I want a testimony." So her testimony was the fever broke. The next day, she was fine. Nobody gets that better that quick on COVID. I don't care, even though she's a little child and probably has a better immune system, it doesn't matter. Nobody gets better that quick. It's usually at least 7 days or whatever, and any flus or colds or anything. And that's why the medical community knows that, and they'll give antibiotics. They know in 7 days it'll cure it, whether the antibiotics did anything or not. So pyrogen is rotten meat, so they would have rotten smells coming out of them, and infections, some kind of infection. Pulsatilla is weepy, cryy, all kinds of things like that. So those are some of the basic medicines that you would use. There's more, but with infections and fevers and things like that, this is what it'd be. So you basically would, well, let's get into it. 12 minutes. All right, I got some time. So, acute remedies and acute prescribing. You consider the keynotes and the major symptoms. So you talk to someone, you say, "What's going on with you?" My lungs, I can't breathe. I'm coughing. What color's your mucus? What else would you ask? What color's your mucus? Do you have a headache? Do you have body aches? Do you have chills? Body aches would be more arnica. They don't have arnica in there for some reason, but arnica is a great flu remedy. Body aches, Bellus perennis is deep tissue aching. So there's different keynotes for all these medicines. So you take the major symptoms and you consider those keynotes, whether it's burning, whether it's throbbing and pounding. And this is why once you have somebody and you can see their face, or you can you get some of their symptoms, you can basically take their keynotes and prescribe on it, and you'd be amazed that, like I said, that didn't matter if that child had COVID or a flu or whatever. What I'm looking at, that's why a lot of these big terms that I throw out, I don't worry about what these terms really are, whether it's dropsy or ascites or all these names. They're just doctor names. What I'm looking for is what's going on with this person. I just talked to a lady and she was going through some stuff. And I said, "What's the main thing you want to get rid of?" And it was bleeding. So now I'm thinking bleeding remedies, phosphorus. Um, and it actually came up, it was corn smut, which was Eustalago. which is a mold that grows on corn. You know, I don't know if you look it up. Ustalago is mold on a corn, and that matched her symptoms. And that's what I'm looking for. What color's the blood? How's the thing? What's going on with you? And that's what you're looking for. Gelsemium, like I said, the keynote is dopey and tired and just worn out. Um, what's the other? Aconite, or yeah, aconite is they're restless, they're fearful. Fear is a big one for aconite. Fear is also arsenicum. Arsenicum, yeah. Arsenicum with has burning. So if they said, they're worried they're never going to recover, or uh, they have their headache, they're burning, the body's burning. There's a burning somewhere. You consider arsenicum. If the fear is the big one, now if it's an injury. This is an acute prescribing for an injury. You don't see nothing wrong. There's no bruises. There's no broken stuff. But they're real fearful. They just had a car accident, right? But you don't see no visible signs of injury, but they're really fearful. You'd start with aconite. Of course, you'd give arnica too, because arnica is another one that's for trauma. These are the basic things. And, if you come into my community, that's what I do. I got all kinds of information in there that you can go through, and I'm creating some courses for like emergencies. That's the first one I'm going to create, because emergency is the first thing you need to know. From that emergency, then you go to something like this, acute prescribing, which is for flus, colds, all kinds of things like that, injuries, all that stuff. Then from there, you can get into chronic stuff. So I'll be getting into that later in the next couple, because I think the next, like the Indian cockroach, Blatta, Indiana, what is it, Blatta something. Anyways, the next one is small. The next couple are small. So I want to get into some of the other ways of prescribing or taking a case or looking at it. So when you get the major symptoms, you always ask, what would you like to get rid of first? Because the lady I just talked to, she had a lot of symptoms, and you can get lost in all of it. And I said, what's the first thing you want to get rid of? And it was bleeding. So we focused on bleeding. So at the same time I did the bleeding, she had a lot of trauma in her life. I told her take, just like the lady in Germany, I said, I just showed them. I said, I got these medicines. Listen to this. And this is my educating people. I'm not here to be a homeopath, because I'm not a homeopath, and I'm not prescribing remedies, but I'm just saying, look at this, and does this match what's going on with you? And that helps people to understand, oh yeah, that's what I'm doing. I'm looking at a medicine and I'm matching it. So, we come into my community, there's a lot of information. I have injuries, and then I have a whole list of remedies with their keynotes. And you match those, you look in and you say, oh, I have a injury or something. I have, what do you want to say? I have a head injury. Then you take that over and you look at head, you're looking at head injury in that one PDF I have, and it'll give you a batch of remedies. Then you go and you look at the remedies and you match those remedies to this, the keynote symptoms of those remedies to what's going on with you. And that'll, so that's my goal, is to teach people how easy this can be, how relatively easy it is to utilize homeopathic medicine. Eventually, when people decide, hey, this really works and I want to understand more, you can purchase a couple books, and the material, the repertory, which is the first book you look into. So you get those remedies, you get symptoms, and you say, okay, I've got an injury. You go to the injury section or head injury, and you narrow it down as much as you can, and you get a handful of remedies. Then you've got to narrow that down to at least like 3 remedies. You're down to 3 remedies. Now you've got to match. You look into the Materia Medica and you match. Let's keep that up for a second. You go to the Materia Medica and you match the symptoms of that person to the symptoms of these remedies. So you look at the remedies, and if you're going for head injury, that's all you got to look under is head. Head with an injury, and you got some symptoms that they're going through, and you match those symptoms, to that, that person's symptoms to the symptoms that they've produced from doing a proving to the symptoms of that person. And that the more the closer you match the symptoms of the person to the symptoms of the remedy, the more, you'll give that, they'll take that medicine and they'll have a they'll feel better. They'll start feeling better. That'll, so there's a whole nother thing where you're either palliating it, or it's actually, getting rid of the symptoms, or you're wrong, and if you're wrong, like, it won't hurt them. It won't do anything. You go to the next remedy. So, it doesn't have to be complicated. You don't have to be exact, because you will not hurt anybody with these remedies. It's not like the common medicine where you will get side effects. Now, if you give a high dose, they can prove the medicine, which will cause them to get sick. So that's a whole nother subject. But you get the major symptoms, and you consider the keynotes of those remedies to match it with their symptoms. So you diagnose the cause and type of disorder: flu, injury, earache. What is the problem here? When did it start? What is the etiology? And that's where they use a acronym CLAMS. Concomitants, what's it related to? Is your headache related to your stomach? Is the headache related to stress? Is the headache, what's it related to? What is it related to in the body? So location, is it in the head? Is it from your stomach? Is the symptoms really in the stomach that's causing the head stuff? So the location and the etiology, what's the cause? When did it happen? Was there an injury? Was there, a lady I gave, when I first started, gave her like 3 medicines for her surgery, and one of them cleared up her TMJ, which was Nat Sulf. She had a car accident. She said, "Man, my TMJ's gone." I'm like, that was a surprise to me. I said, "Did you have an injury or car accident or something when you're," "Yeah, I was in a car accident, then the TMJ started." This is years later. Nat Sulf cleared up that leak of energy, cleared up her TMJ. So, uh, location, modalities, what makes it better or worse? And like I always say, bryonia is worse motion, rust tox is better motion. So if a person's, and I had to ask that for a friend of mine, their knee was injured, their son's knee was injured. And I said, well, let me talk to him. I said, now, let me ask you, does it feel better when you're laying down, and when you're moving around all day, it starts hurting bad and you lay down and it feels better? Or when you get up, when you're laying there, it hurts worse and you get up and move around and it gets better? Getting better is rust tox when they move around. Bryonia is worse from movement. He said, it's worse when I get up and move. He took bryonia, gone. No more knee injury. Now the doctors were checking it out and doing this and doing that. And, nothing against them, but they really didn't have nothing. I think he had some surgery or something on it or whatever, and they tried things. Just like my mom, she has carpal tunnel. They did surgery, still has carpal tunnel. You know, I started giving her Ruta. Now I don't know, I can't give it to her like I should, like I would like to, because she's like, you think you're a doctor. No, I'm not a doctor. I'm not even a homeopath. I just been utilizing this for my family for years and helped them through a lot of stuff. So I'm going to continue with the Ruta here and there. Now, potency is a whole nother thing. And it doesn't matter if you can get that medicine into them, whether it's a 30C, a 200C, a lower dose, whatever you have, you start taking it and you continue to take it. You can take it as often as you need to. And then whenever you start feeling better, you can back off. And then once it's gone, you don't need the medicine. Unlike the common medicine, which if you don't take the medicine, it'll come back. So, all right. Type of disorder, and then sensation. What's it feel like? That always helps me. My wife's headache, 10 Tylenol PM. Sal, I got a headache, and I come home from work, and I'm like, I'm tired, I'm dirty, I'm hungry. What's it feel like? Stabbing, throbbing, pounding, bursting, burning. I gave her a bunch of things to think about. She said burning. When arsenicum, the keynote is burning. I gave her arsenicum. Come down after I showered. She's on the phone talking, happy, like nothing happened. 10 Tylenol PM did nothing. Now, is Trump right about Tylenol? They're not the best things for you. If they work, great. Get rid of your headache. But if like my wife took 10 of them, Tylenol PMs, that'll blow up your kidneys. That didn't work. Arsenicum, 1 dose, gone. That's how quickly it can work, you know, just from a keynote. So that's the sensation. What does it feel like? If she would have said throbbing, my head's throbbing. I would have gave, and her face was, her cheeks were flushed. I would have gave her belladonna. That is the keynote for that one. Find the primary rubric in the repertory, influenza. So when I say the rubric, that just means the disease thing. This is the repertory, and the rubrics are, let's see, let's get influenza. Okay, let's go to fever. A, B, C, D, E, F. I gotta know my alphabet. F, G, H. Where's the fever? Female and fever. I go to fever, go under I. Where's the I? Influenza. So this is a rubric, fevers, right? I know person got a fever, and I'm pretty sure it's influenza. I go there, and there's the remedies. Gelsemium, arsenicum, baptisia, bryonia, phosphorus, rust tox. Those are the remedies. Now you get more rubrics, or sub-rubrics we'll call them, ailments from gelsemium. So any ailments from that fever, gelsemium would be considered. Now, if they're dopey in that would definitely be pain in limbs, bryonia and eupaturium pers. So these are the sub-rubrics that break down. I got a lot of medicines up here in influenza. Now, if I get a sub-rubric, ailments from gelsemium, that breaks it down. I have pain in limbs, bryonia, and eupaturium pers. So these are the sub-rubrics. Stomach stuff, I get a little more. So this is weakness from gelsemium, phosphoric acid, carcinosum. So you're basically, in these ones, when I say a 3, that's the bold type, right? Is it coming clear? That's the bold type. Now, I don't know why it's not clear. The other remedies, let's back it off. Now, let's get closer. The small bold is like carbo-veg. That's a 2. There we go. No, that isn't carbo-veg. What is that? Nux vomica. That's a 2. Now, phosphoric acid here is a 1. So this is one you wouldn't consider as much. Nux vomica, it could be, but gelsemium in these ones that are bold are more likely in that situation. So that is, once you go to that repertory, you get these medicines, then you go to the materia medica. All right, and look up the medicines and try to match it as close as you can. Differentiate major remedies in the materia medica. So when you're talking differentiating, you're talking, throbbing compared to burning. This is the differentials of these remedies. Throbbing is belladonna, burning would be arsenicum. So this is how you differentiate between them. Then you choose the most similar remedies, the remedy that matches this person's symptoms the best. When you can match it, and this is how easy it can be. You're matching those symptoms of that person. You don't have to know all these ACDs and all these medical terms. That's why when I talk about them, it's like, yeah, it can help, but it's not necessary. So you don't need to know all that. Choose the potency and repetition. What does that mean? The potency is like a 6C, a 30C, a 200C. Centesimal just means it's put into 100 drops of alcohol when it's produced, when you make the medicine. Then you pound it 100 times. That gives you a 1C of whatever substance you have. You can take arsenic, which is a poison. You can potentize it. 1C, 2C, 3C, 4, and the more you potentize it, the more it's diluted and the stronger it gets. It's got to be, it's counterintuitive. It doesn't seem right. But anyways, whatever potency you get, you can increase the repetition or you can increase the potency. Or if they get aggravated from it because it's too strong, you can lower the potency and lower the repetition. So you can play with those whichever way it needs to be to get that person it working for that person. So you follow up to determine if the person needs the same remedy in potency, same remedy and different potency, or a different remedy and potency. So that's why those are the things you're playing with, is the remedy, the potency, and the repetition of it. So that's why I put it in water and I tell somebody pound it and take it every 10 times, take it every 15 minutes. And as they do that, they start getting better. I did that with a lady who had hip problems. And when I did that, and I was just doing her marble. She was in a wheelchair, and then the next day, she did it every 15 minutes. The next day, she's standing out of that wheelchair and said, "My God, my pain's 90% gone. What did you give me?" So I brought my books in, showed her husband, which I'm pretty sure was a doctor, and they still didn't understand. But I said, "Don't do nothing because I didn't take care of your problem. I just removed your pain." So she needed hip surgery eventually because she had a bad hip. So 30C, 200C are effective potencies for any acute and emergencies. When indicated, follow the acute with deeper acting chronic or constitutional remedy to help restore health and prevent relapse. So this lady I'm dealing with, I gave her a remedy for the bleeding, but also all the trauma she had, just like the lady in Germany, I told her, I didn't give her, I don't give medicines. I told her, here, look at this. Does this match you? Yeah. Okay. And I told her the symptoms I was looking at. She said, yeah, that matches. So I said, well, go ahead and purchase it from wherever you're going to get it, and take calcarb as a constitutional. So take your remedy every, daily until the bleeding stops. And then take your that other remedy as like almost like a constitutional thing. And that's what the lady did in Germany. I said, these medicines, here's the three. Which one matches you? She said, calcarb. She took it. She said, yeah, I'm 30% better. Well, she quit taking it. I said, keep taking it and let's get you 50% better. Let's keep going. And I told her, I said, once this is gone, you may have another picture that comes out and you would need a different remedy. And you keep doing that until you peel off all the layers of disease that you went through, trauma, injuries throughout your life, until you're down to your constitution. Then you take that remedy. So that is morning medicine. I'm a little over, but I hope that is very helpful. And this is the things you'll get in my community. You can come, use all the stuff for free, because I want it to be in everybody's mind first off, and then in everybody's hands so they can learn to use it, especially if you lose your health care or you're in a situation where the doctors, like my wife's foot with the bump on the bottom, they looked at it and they don't know what to do with it. And I'm having troubles with it because she had her tendon was cut when she was young by her sister. And now, is that the problem? Is there some other problem? So yeah, some of them can be quite tricky, but most likely you can take care of a flu, a cold, a COVID, whatever it is, quickly by knowing a few of these concepts. So that's morning medicine. You can age, but you don't have to get old.